Hello, and welcome back. I apologize for the earlier inconvenience with the computer technical difficulties, but as you can see, we are back, and I am going to resume where I left off. As I am sure that you recall, there is no cure for Alzheimer's, nor is there a way to reverse the cognitive abilities that were lost. Please keep in mind that the neurons are not regenerative. Once they're gone, they're gone. There are, however, methods to slow down the progression of Alzheimer's, as well as to help the patients manage their symptoms. One such way is through exercise. Now, keep in mind that a majority of Alzheimer's patients are seniors, those who are 65 and older. This means that the exercise that is recommended for them has to be gentle. So we are talking about walking around the house, simple stretches, not running around the neighborhood unless their doctor gives them the okay. Because there are some who would be able to withstand that strain, but some can't. Nevertheless, studies have shown that exercise, regardless of one's age, does hold benefits for cognitive abilities. As well as keep in mind that there are links between obesity and Alzheimer's, another reason for exercise. And then there is diet. So it's always important to eat a healthy diet, but it's especially important when one has a serious disease. And there are even some superfoods that have been shown to improve brain function. One of the most common are foods that have omega-3s, such as salmon. It's also important to avoid foods that are high in sodium and high in fat, which could further aggravate the Alzheimer's progression. And then there is therapy. Now, the most common type of therapy for Alzheimer's patients is what they call memory therapy, which is basically where the therapist tries to help the patient retain their cognitive and memory abilities. Remember in my earlier presentation of how I mentioned that keeping the mind active through learning new skills, puzzles can help reduce the risk of developing Alzheimer's? The same idea translates to the therapy in order to help the patients retain their cognitive abilities. It's basically the same idea. And finally is medication. Now, there are different types of medication that are currently available, as well as ones that are being developed. And I want to go more into that in just a moment. Now, one of the most common medications are called chlorinase inhibitors. So most of the time they are used to treat mild to moderate Alzheimer's symptoms. And you'll notice that what they all have in common is that these medications try to prevent the breakdown of acetylcholine in the brain. Now, you might wonder why this is so important. Acetylcholine promotes neuron growth. However, there are the fluorinase receptors cause the breakdown of the acetylcholine, which in turn will reduce the neuron's ability to grow. Now, as stated many times earlier, Alzheimer's targets neurons. Therefore, anything that can help the neuron is encouraged. And so here are 3 of the chlorinase inhibitors. First, we have Rasuline, Ezolene, and Aricept. These are just a couple of the common medications, though there are others. Now, remember earlier how I mentioned certain foods can help the brain? Another one, it turns out, is the D3 vitamin. In recent studies, it has been indicated that the vitamin D3 helps to clear away the amyloid beta plaques. However, it has to be in high quantities in order to do this. A later study found that curcuminoid, which is found in turmeric, increases the vitamin D3's ability to clear amyloid beta plaques. However, it does not reverse the damage done or stop the damage being done, because keep in mind that amyloid beta is one of the earlier steps in the Alzheimer's pathway. So even if the amyloid beta has been cleared away, that does not stop, say, the reactive oxygen species from causing neuron damage. However, it is a start, because if the amyloid beta can be cleared away, it can buy time in order for other treatments to take effect or to slow down the progression. And then there are current experimental anti-inflammatory treatments. Remember earlier in the theoretical pathways of how the inflammatory response leads to neuron death, which can lead to amyloid beta deposition, which will lead to tau hyperphosphorylation, which will lead to Alzheimer's. And there have been studies that have indicated that that inflammation does lead, inflammation of the neuron leads to Alzheimer's, which is why scientists are why one of the focus is anti-inflammatory treatments for neurons. So there have been studies that suggest that long-term use of NSAID drugs can protect against the development of Alzheimer's disease, but there is currently little evidence over how efficient this is. Another current experimental anti-inflammatory treatment is 3K3A APC, which is a modified version of a blood-based protein, which under normal circumstances protects the brain cells and blood vessels from damage due to inflammation. And there are also current experiments being done on possible antibodies for the tau protein. So what these scientists hope to accomplish is antibodies that would, as they put it, absorb the excess tau protein, which would thus prevent clumping into the which would prevent clumping into tau tangles, thus preventing neuron degeneration. Though I have not seen anything regarding clinical trials yet. And that's the end.